Having a child struggle with reading is scary beyond words. It's scary because being able to read in today's society is as crucial to survival as hunting was for our ancestors, and being unable to read well closes so many doors. Chances are, if you're watching this, it's because you know someone struggling with reading, whether it's diagnosed or undiagnosed. And that's just the problem with reading struggles. So many people struggle, but many don't quite meet the diagnostic criteria and never get the help that they need. And the ones who do meet the criteria, well, the minute they're told they have dyslexia or a reading disorder or a language-based learning disability, they start to believe that they can never learn to read well, and many of them believe they can just never learn. And as a teacher, I held the same belief for years. Years of conditioning had me thinking the best we could do is offer these kids tools that require them to read and write less and develop coping skills, maybe some basic literacy skills that can help to kind of get them through, use some assistive technology. How terribly mistaken I was. Dr. Sally Saywich, the leading expert on dyslexia and reading intervention, states there is no excuse for a child to be unable to read in this day and age with the correct reading intervention or reading therapy. It is possible for even the supposed severely dyslexic to learn to detect phonemes, to blend sounds together, to no longer reverse, to understand what they just read, to become fluent readers. Several years ago, I would have said, if you can get a dyslexic child to read, then it's a miracle case, not a regular occurrence. By chance or fate, call it what you want, I came across a reading program several years ago that was successfully able to retrain the brain of a struggling reader, and the results were astounding. The more I read about it, the more I couldn't stop thinking about it, and then I just couldn't stop doing more research about it, and in no time I had pursued studies in various educational therapies, like brain integration therapy, integrating primitive reflexes, and then, of course, I sought training with both the Southfield Reading Intervention and Orange Neurosciences Reading Therapy Program, known as ReadOn. By far, my favorite so far. I started seeing what I had never thought possible. Kids with moderate to even severe reading disorders at even the age of 13 years old were reading within months to weeks, and moms were sighing in relief. Whether it's a 13-year-old that could read 3 words at a JK reading level and in 4 months ran up 15 reading levels, the girl that I worked with who could read but never could understand what she was reading, who had amazing reading comprehension by the time she was done the program, or the 8-year-old who no longer reversed letters in as little as 2 weeks. This is what I see in my office all the time. Parents regularly tell me things like, he wants to read now, or by far the best review of the program has been, I had to tell her to get her nose out of the book. I had to tell her to go outside and play. This is a kid who used to hate reading. These kids do not need another tutor. They do not need another remedial reading program. That won't work for these kids. They need an approach that corrects the source of reading disorders. These kids need a therapy that is designed specifically to train their brain to read in the same way that a fluent reader does. They need an engaging reading therapy that doesn't make them feel like they're reading at all, especially when they first begin, because let's face it, most of these kids hate reading. So Reading Rockstar targets all of the areas that can contribute to breakdown in reading and processing in terms of retaining what they're reading. So first I assess nutritional deficiencies as well as sensitivities to make sure the brain and eyes are getting the nutrients that they need in order to work properly. And then my integrated approach incorporates the exercises and therapies that science has shown to turn struggling readers into fluent, willing readers. If it's hard to imagine, let me tell you, I see it all the time. These educational therapies, or what I call better brain rehab, eliminates reversals and words moving on the page through things like eye tracking exercises, eye teaming exercises. It improves the ability to differentiate and remember various phonic sounds, as well as how to blend them. It improves their reading comprehension by freeing up that working memory so that they can use it to retain the content. And it coordinates the brain and the body, which is so important for reading and learning in the brain. So this multi-sensory reading therapy integrates the most well-researched and science-based therapies that are aimed at correcting dyslexia or reading disorders, and it's integrated into one program. So through fast-moving graphics, differential sound training, exercises that reorganize the brain, and targeted nutritional therapy, and a game-based platform so that kids are engaged and want to attend reading therapy, they're engaged and motivated because it is unlike all the other reading programs that they've done in the past. It doesn't feel like school. It doesn't feel homeworky. Results happen fast, and this creates a rewarding cycle. Believe it or not, these kids actually want to practice reading because they are now seeing improvement, and that just continues to fuel this amazing cycle of motivation and engagement. So if you want to learn more about how you or your child can get started with the Reading Rockstar program, give me a call and we'll get you started. Thanks for listening.